Hello, and welcome to the Love Mia Vita podcast. I'm Gerianne DiPiano, CEO of FemPharma. Thank you for joining me as we discuss all things women's health and wellness. Please note that this information is simply that. It's information to help you to think through your decisions. Please consult your medical practitioner to discuss your personal situation. Thank you. This is a trigger warning. The following discussion includes mention of suicide and suicidal thoughts. If you or someone you love is struggling with thoughts of suicide, please call the Suicide Prevention Hotline 988 or visit 988lifeline.org. Thank you. Hi, Nicole Swiner. Dr. Nicole Swiner is a family physician. She is a publisher. She is so many different things. She also happens to be a medical advisory board member for FemPharma. So we're really excited to have you, Nicole. Maybe you can fill in the blanks for those listeners that haven't met you before.
Yeah. So thanks as always for having me back. I, thoroughly enjoy being involved with the company, the organization, the podcast, all the things that you're doing. As mentioned, I'm Nicole Swiner. I'm a board certified family physician, wife, mom, balancer of all things, right? That doesn't exist, but trying to balance the things of life, husband, children, medical stuff, speaking stuff, writing stuff, all the things that I have incorporated into my life. But I'm just someone who's willing to help, willing to give good advice. I love talking to women that are doing all the things so that we can figure out how not to go crazy, how to try to live a long quality, long, good quality life and have some joy in it. So, all the things that I do in my career, I try to put into that same bubble, just trying to not go crazy and have fun.
I think that is fabulous advice, and we could all be doing more of that, right? So
Right.
this is really the topic of our podcast today is really a passion project. That's the way that you define a passion project. And as you heard, Dr. Swiner is also a publisher, and she's written some great books. What she has written that was really intriguing to me, because it occurs to me that healthcare practitioners struggled from burnout during the pandemic, but you know what? They struggled from burnout even prior to that. We all know the cliche or the phrase that's used, doctor, heal thyself, but how many doctors really take their own advice? And so this book that was published in 2019 is called Doctoring Better: 11 Top Doctors, Physician Coaches Reveal Secrets for Helping Others to Create Better Lives. Wow, I read it and I loved it. I thought it was fabulous. And so perhaps we can start by what inspired you to write this?
Yeah, I'm glad that you found some inspiration from that book. It's been a while actually since I've talked about it, since we launched it. And the inspiration came from me kind of going through my own journey. I was in private practice for 15 or so years, co-owned the practice, which was never part of the plan. I never got into medicine to own a business. I got into medicine just to treat the people and fix the things and put a nice bow on it and go home. But that's not what medicine is nowadays. Nowadays, medicine is a business, particularly if you become a partner of your practice or you're in the C-suite of the hospital. You're working the business of medicine. So after about 15 years or so, as you mentioned, the pandemic hit. And even prior to that, I'd already been suffering from what I talk about a lot, the superwoman complex, and trying to balance all the things and take good care of myself. But the pandemic added even more of a layer. But as mentioned, this book was published in 2019, before the pandemic, right? So even before then, I started seeing signs of both in myself and in my peers and colleagues, particularly female physicians, which this book is all made up of. We're all female
Yes.
physicians, that had trouble, even if you weren't married with kids, you had trouble with finding yourself or I guess, finding yourself again, right? You know, you kind of lost yourself in the field of medicine because it becomes all encompassing. You know, being a physician, being a doctor, being in the healthcare field, you care so much about taking good care of people that you lose yourself, or you're working for a system that really is a machine. You know, they want you to churn out the patient visits, make sure you're billing appropriately. The patients want to make sure, you know, you want the patients to feel like they got everything out of the visit they came to get. Sometimes that means, you know, being late to the room or having to apologize to the next patient that it's going to take a while before you can get back to them. You know, a lot of that guilt, it just compounds a lot of us. And so we figure, you know, is this really what I got into the field to do? Like, why am I feeling this way? And how can I not only find a way to feel better myself in this field or leave the field and do something different, but still be involved in health and wellness in some way so that I can be a better person for myself, for my family, for my patients, and then hopefully encourage other physicians to kind of to figure things out. So it's complex, it's complicated, and I really wanted to talk about not only my journey but the conversations that my folks, you know, in my peer groups and in my Facebook groups and in the professional groups that I was in. I wanted to bring some of those conversations to light because clearly we weren't the only ones feeling those ways. Does that make sense?
It absolutely makes sense. And if you're
Okay.
a healthcare practitioner and you're listening to this podcast, you probably can relate. There were 11, right? So 11, I would call them physician life coaches
Mhm.
that shared their stories. And what was interesting to me is the journey of these young women who decided that they wanted to enter the practice of medicine, many of them as young children, deciding, in elementary school, middle school, that they wanted to become physicians.
Mhm.
And others that came to it a little later, but still were driven to help others, right? And so, and the journey's not easy. These are really smart, very accomplished individuals. The
Mhm.
journey is not easy. So you take for granted that to arrive at this point where you have MD or DO behind your name,
Mhm.
not an easy journey. Even if you were someone that had a fairly straightforward path, let's face it, most of us don't have a straightforward path.
Mhm.
And then as women, which I thought was another feature of this. So if you're listening to this and you're probably a woman, you get it. Because as women, we are largely tasked with being the caregivers. So think about it this way: caregiver for your parents, caregiver if you choose to have a partner, caregiver if you have children, and then you have caregiver for everybody else.
Right.
So this is what was interesting to me is reading the stories, and I strongly recommend that if you are a healthcare practitioner, this is something that probably will resonate with you, irrespective of what your specialty may be. And let's face it, there are going to be some specialties which are going to be much more demanding and require much more personal and professional discipline. So let's talk about the two:
Yeah.
professional discipline and then personal discipline, because those were some of the themes that at least I picked up.
Yeah. So yeah, you made a number of good points. So you're right. You know, as women, most of us are very natural, nurturing, caregiving creatures, right? That is essentially what stereotypically differentiates us from the male species is that we are maternal, right? And so it actually makes a lot of sense for a lot of women to be in the healthcare field, whether it be nurses, doctors, nurse practitioners, PA, you know, it's just kind of a natural place for us to be because we care. Um, but that adds on extra layers of stress because you're right, the caring doesn't end, you know, at your 9 to 5. Then you have to go home and care for other people. And then where do you have time to care for yourself? So it takes a lot of what I had to learn and what I learned through, you know, my quote superwoman journey is how do you create boundaries that are loving, right? So there are some that can, they're very hardcore. They're like, my time cuts off at this time, or I have 20 minutes to be with this patient and I'm in and out of the room and I'm going, and or at 5 p.m. I'm done, my computer's closed, the shutdown, I'm not looking at any phone messages or lab results or anything. But not many of us can do that easily. Because again, you care, or you have the guilt, of, I told the patients that I was going to get back to them in 24 hours. I got to make sure I'm on it. And then I got to make sure that I'm taking my kid to practice on time. I got to make sure I'm making that dinner that I wanted to make. And so there are a lot of pressures that we put on ourselves personally, that society places on us, that family members have placed on us. Growing up, we've seen our foremothers do it and balance it all and be successful and do all the things. So what's wrong with me that I'm stressed out all the time? They looked so happy. They were not, right? We now know the truth. The older you get and the
Mother's
more,
little helper, right?
right?
50s,
Right.
60s, mother's little helper.
That's right. That's right. And then the older you get, the more, of course, that you can see behind the veil or see behind the mask or see behind the curtain that mom was stressed out a lot. And there were some tears and there was some self-medicating and there was some, things were happening that we may not have known about when we were younger, but now we know, now we understand. And it's hard to balance the two. So it's an ongoing struggle. This in this book and in this journey that we're all on, we don't have all the perfect answers, but I do like to share the good news is that if you are feeling this way, if you are having, these challenges of figuring out where do I as a person fit in all this wonderful madness that I've created, there are ways that you can fix it. And there are beautiful ways that you can transition your practice, your career, your field, your knowledge, your expertise. There are wonderful ways that you can take those things. You can pivot. And that's one thing we definitely learned from the pandemic is how to pivot, how to transition, how to switch roles and shift things so that it makes sense for you and that you still feel like you're fulfilling that nurturing caregiving need that most of us innately have. So there is good news. I don't want you to walk away feeling like, well, yeah, she's struggling too. We're all struggling. There are ways to fix it.
I think that I always love to hear about the hope that you have and others have. So yes, there are issues that we all face. They are largely surmountable, not insurmountable obstacles that come in our way. And we have to show ourselves some grace. And I think from what I read in the book, this is about the lack of grace, the lack of giving oneself grace. So what's struck me as being interesting is that you describe some of the different coping mechanisms that these physicians described in detail in the chapters in this book. And they talk about everything from not eating properly, not getting enough sleep, um, maybe medicating. And by the way, self-medicating doesn't necessarily mean with a prescription pharmaceutical. It could be alcohol. It could be nicotine. Um, Years ago, I worked in an ER in a hospital, and I
Mhm.
watched physicians, whether they were attendings or whether they were ER docs, that would leave the ER, go outside and smoke a cigarette before they would have something to eat or drink
Yeah.
stale coffee and then just run right back in. And I
Yeah.
always wondered, do I want to do this? And obviously I did it.
Yeah.
I didn't. I'm not saying my path was easier, it was just different. The
Mhm.
bottom line is that they talk about the different challenges that they faced, and then they reached this pivotal moment. For some, it was, at least for one, she thought about ending her life.
Yeah. Very real.
So we talk about physician burnout and maybe, what are the signs that you're burning out? And then how do what do you do to change that?
Yeah. Well, you're absolutely right. I mean, that is one of the most unfortunate and most extreme end results and very real end results for physicians is unfortunately um, burnout to the point of mental health issues that then potentially can lead to suicidal thoughts or even suicidal attempts or, to completion. Suicide, particularly in the physician work group, and I need to actually check the more recent stats, but I know that prior to the pandemic, the numbers were higher than war veterans. War,
Not know that.
right? People that fought in
Wow.
wars.
Wow.
The physician suicide rate is tremendous. And it feels like maybe it's been a little bit less since the pandemic hit, but I still see stories, unfortunately, too regularly. Too many posts, too many RIP, posts of colleagues of mine that have lost their lives to suicide for a multitude of reasons. So something has to be done. I feel like we're getting a little bit better, as a world, as a population. I think we are doing better with destigmatizing mental health and talking about what bothers us, whether it's because of social media, whether it's the younger generations now being more open and honest and transparent about everything, that I think has had some positives because now we feel a little bit less um, judged, hopefully, by talking about what's really bothering us. And so that has hit every realm: work, life, marriage, kids, all that stuff, just talking about what is bothering you. So I think it's gotten better. And clearly, by having one of us, having a life coach or a therapist or a physician consultant, someone that would feel comfortable, to you to talk to, having someone to talk to about these things makes a difference. And someone particularly in your field or in someone like you, someone who has been in your shoes, makes it much more comfortable because they can speak your language. They know exactly what you mean when you say, I worked 3 12-hour shifts and I didn't sleep for 3 days, right? So they know that feeling. So I think I probably lost track of the question that you asked, but but
No, you didn't,
in
because
general.
talking about this particular chapter that I was referring to, and at the extreme.
Yeah.
Let's face it, for those of us that aren't practicing physicians, sometimes we have this feeling that the individual that is a practicing physician is a deity in a white coat. And I say
Right.
deity rather than to make it infuse religiosity into this.
Yeah.
But you are not deities in a white coat. Maybe you're empowered by a higher being
Mm-hmm.
because you wanted to practice healing. So
Yes.
maybe there was inspiration there, but you are not a deity. And therefore, you're not capable of doing miracles.
Mm.
But you may feel that way. You may feel that hyper empathic nature that
Yes.
makes you take this home with you, that makes you feel bad when things don't go the way you hoped for, that you've tried
Yeah.
your best, but your best just wasn't good enough. You're not a
Absolutely.
miracle worker. So I think that's at least what again, when reading this, it really brought home the fact that healthcare practitioners are just like the rest of us, but perhaps they are more empathic than the rest of us, and that's why they do what they do.
Yes.
So moving past that, I think you mentioned attending to your mental health, and there should not be a stigma attached to it. It's getting better,
Yeah.
but it's important for us to take care of you first. And we often read in the book things about filling up your cup. So
Yeah.
I use that as a metaphor. Maybe we can talk a little bit about how do you fill up your cup. So if you get to that terrible place, and by the way, we will put a disclaimer here for anyone that feels like this,
Yeah.
so that you can seek appropriate medical attention.
Yes.
You do not have to live with these feelings.
Correct.
But having said that, what can we do? So what are some of the techniques that, and there's a lot in this book that is really super helpful, but maybe you can summarize some of this.
Yeah. Well, I'll say, particularly for my physician folks, there's still, again, it's gotten better. I think we're destigmatizing the myth of keeping what's going on with you in the house. We grew up kind of keeping it in the house and keeping it closed, and what goes on in here, you don't tell anybody about. That's getting better. We're doing better. We're talking more. We're sharing more. But there is one thing that still needs to be fixed, and the thing that I talk about a lot with my colleagues is that for some board applications, the thing that makes sure that we're doing all the things and keeping up the education the way that we're supposed to be doing that in order to have board certified next to your name. Some disciplines ask, have you sought out mental health, care at some point throughout the last couple of years? Or are you taking, antidepressants or anti-anxiety medications? And a lot of docs either won't be truthful about it because they're afraid or they're embarrassed or they feel guilty, or it will prevent them from seeking out treatment because they don't want to get in trouble for it. We have asked that many of us have asked that those types of questions be removed from the process, that it should be confidential, just like we have to follow HIPAA rules. Why don't the same things apply to us when we're putting in, like, for our career development and applications? Like, that's ridiculous. So that needs to be removed. That's a big deal for those that are suffering, that are thinking about seeking out treatment, thinking about taking a medication to help them with their mood or their mental health, but feel judged or feel like they'll get in trouble for it, feel like their license could be in danger for doing that. So that needs to be removed. However, filling your own cup. What I did, and again, I talk a lot about my personal journey. What I did when I was really feeling stressed out, I was kind of figuring out what's my next step. Like, am I loving taking care of people in clinic enough that I want to continue doing this? Do I want to do it in a different way? I'd already kind of started, doing the publishing, doing the writing, doing the speaking, the workshops, was loving that part of medicine because I could take my medical expertise and then shift it and do it in a different way. I was loving that piece. And I was just trying to figure out, like, what do I want to be when I grow up? That's always going to be a question. What I did was I actually took FMLA. And so FMLA, as I'm sure many of you know, is when you can go to your physician, your healthcare provider, and they can write paperwork so that you can have time off work to just heal, whether it's from an operation you had, you're having some huge medical, crises going on, you're taking care of a loved one that needs your help and you need extra time off from work. But what I did as a physician is I went to my colleague who is a psychiatrist, had some sessions with her. She kind of helped me figure out where I want, what route do I want to take in this career? Am I stressed out? Why am I so stressed out? And she wrote FMLA paperwork for me for stress, period. It
Fantastic.
doesn't, right? It doesn't have to be major depression. It doesn't have to be bipolar. You're stressed out. We call that adjustment disorder. There's an actual billing code for adjustment disorder or adjustment reaction. And she helped me to take 3 or 4 weeks off from work just to sit, just to be at home, be still, get some rest, figure things out, and just do nothing. So that was helpful for me. I think as a physician, we don't really think about we do that a lot for our patients, but we rarely think about doing that for ourselves. When I took maternity leave, I had, a certain amount of weeks of paid maternity leave that was available. But what I did was I asked my primary care or my GY or OBGYN, can't remember which one I asked to do it, to add on a certain amount of weeks of short-term disability. So once you've run out of your vacation or run out of your PTO, run out of your maternity leave, you pay every month. If you're working for a big hospital organization, they are taking money out of your check for short-term and long-term disability. That short-term disability, you'll get a portion of your salary paid, but it's not full on paid, but it's something. But it's specifically for those reasons. You're tired, you're stressed out, you need more time available for whatever, and it's legal. They have to give you that time off if you request it, particularly if your doctor requests it on your behalf. So that was what I did, to have a couple of extra days of maternity leave when I needed it, or take FMLA when I needed it, because it's almost like it gives you permission. Not many of us will take 2 and 3 weeks off of PTO, even if we have that vacation saved up, just because got to work. The patients they need us, right? But if
Yeah.
it's the doctor telling you you need to, we feel a little bit better, right?
So true. It
Yeah,
is so true. So, I laugh because so being Italian, there's an expression I won't say it in Italian, but it is the sweetness of doing nothing.
I love that.
And the sweetness of doing nothing is really an opportunity for discernment. And if my memory serves me correctly, and I read this a little while ago, the book a little while ago, that's really where you and the other physician coaches arrived. So you needed to take that time to sort of sit with yourself and do nothing, whether it was in a yoga studio or whether it was out in the garden, whether it was engaging with an integrative medicine specialist to try to figure out, okay, how do I get myself in better shape? How do I focus on diet, on nutrition, on doing exercise? And when you think about a physician running around, right, between patients, between rooms, you're not sitting. But here's what's happening. You're not really exercising in a mindfulness sort of way. You're
Absolutely not.
moving around a lot, but then you might eat a French fry or drink a shake or worse, right? And you're not really, you're not filling your cup up. So you have to get to that baseline where you sit and do nothing, the
Yeah.
sweetness of doing nothing. And then, so what are some of the strategies that you share? And again, your techniques and strategies may be similar, or they may be dissimilar from some of your colleagues in this book. That's why I encourage everybody to buy the book.
Mhm.
Get it on Kindle. And it's really an easy read and it's very helpful.
Good. The things that I talk about with colleagues are same things I talk about with patients, clients, friends who are in healthcare, not in healthcare. Actually, yesterday I did a Superwoman workshop for a yoga studio and some of their participants, and we had the same discussions that I have with everyone. And it's kind of there are some cardinal things that I always review when it comes to being a superwoman and fixing it, right? Big one is sleep, and I talk a lot about making sure you're getting your rest. The other one is creating those boundaries and saying no. We have to learn how to say no. So, from a clinical standpoint, even though I've been now outside of the clinical setting for about 3 years, doing other things in medicine and health and wellness, but a lot of things I remember come from me feeling locked in the clinical setting and feeling um I don't know, almost strangled by the expectations of everybody. So the expectations of the management company, because they wanted us to make a certain amount of money and see a certain amount of patients, feeling kind of strangled by the expectations of the patient, because when they come in the office, they know they only have a couple of minutes, but they have this long list of things you got to get through, and they want all these questions answered, and I can't take off of work and come back again, so you feel these pressures. One thing that I had to work on was saying no, which sometimes meant I can't see, like, don't overbook me. Even though the hospital system, the management system wants me to see 3, 4, 5 new patients within an hour, with a brand new patient who has 5 to 6 chronic diseases, who also has a cold that day or they have knee pain that day, I need an hour. Can't take an hour, but I need an hour with each. So don't, we have to stop overbooking, because they would have your routine visit, your physical, and they would fit in an acute slot sometimes in the middle of those two so that you would be running. And sometimes you could make it work, especially if you have really good support staff and they can be in one room while you're in the other and help you that way. But you get so physically and emotionally and mentally tired that you can't focus like you really need to. So I, at some point, said, we have to stop overbooking. It is what it is. I want to take the time I need with each patient. So saying no, asking, sometimes when those patients have 3 and 4 and 5 and 6 questions on their list they need to have taken care of. Sometimes you have to lovingly remove that list from them and say, okay, I'm looking at your list. I see all these things are very important and I want to make sure we cover them, but let's do the top 3 today. And then let's have you come back in a couple of weeks and let's do it all over again with the other important ones. Because you don't want to feel rushed. You don't want to feel antsy and anxious because you want to hurry up and get through all the things, but you also want the patient to feel like they got what they paid for, right? And that you heard them and that you listened, and you didn't just rush through. So saying no has a lot, it can cover a lot of different things. Saying no can also mean saying no to those belligerent folks. We had a couple of instances that, just as people just in general got angry and angrier or more antsy, more anxious, they would sometimes take it out on the staff, or they would call and, cuss out the receptionist, or they would show up 30 minutes late to their appointment and demand that you see them. You have to put your foot down and establish these are our rules. this is what, when you became a new patient, this is the agreement that we both signed for good behavior. And we can't tolerate that because you're stressing everybody out, right? So you have to, say no in all the respectful ways that you can so that you can preserve your sanity. And then you feel better about when you do see your patients, you have, a routine. They know what to expect. You know what to expect. There are minimal surprises in medicine. Of course, there are always going to be surprises and emergencies and all that. But you both can come into a calm setting, a calm environment, and have an open discussion about their health. So that's a big one, but it covers a lot of different areas.
It absolutely does. It's interesting. We hear a lot about physicians not having the right medical school training to adequately deal with some of the patient questions. And we especially hear that in women's health care because let's face it, in medical school, everything is about the default male. In
Mhm.
many different disciplines, it's all about the default male. So we don't want to only indict what happens in medical schools. And there is work underway by the American Medical School Student Association to change that. So hope and help is on the way. But
Yes.
we often forget the fact that many practices are acquired by private equity firms. You mentioned this earlier, and it becomes a factory. So
Yep.
even though you are a professional, it becomes like a factory. And for those of us that are, patients, including physicians who are patients, you get it because you walk in and your doctor says, you are my 34th patient of the day, and it's only 4 o'clock in the afternoon. So
Right.
think about that math for a minute. How much time can be spent with the patient? Did your doctor ever have time to sit and have coffee, go to the bathroom,
Right.
just decompress?
Going to the bathroom is a privilege. Absolutely.
I mean, these are basic necessities. So you take for granted that this person that showed up is going to give you 15 minutes, and that's not going to cover it all. So I like the idea of the boundary where you say to the patient, because it's good for the doctor, it's good for the patient. Let's cover these three important things today,
Mhm.
and then let's make an appointment for 2 weeks or a month from now, depending upon the sense of urgency. But let's face it,
Mhm.
all 15 aren't urgent. Maybe
Yes.
three are urgent, and the other 12 can wait for 2 or 3 or 4 weeks, depending upon what they are. I mean, if you've got
All are
athletes,
important. You want to let them,
exactly,
they are important to me, just
yeah,
like, but not all of them are urgent.
urgent.
That's a
Yes,
good
important but urgent.
differentiation.
So I do like that. And that also gives you a little bit of grace because let's face it, if you can get through in, let's say, 20 minutes or a half an hour, the top three, and that even that seems like it's not enough time, but
No,
it's better than trying to cover all 15 in
correct.
15.
God bless. Or with the advent of telemedicine and virtual visits, what I would do a lot is I would say, okay, we're going to focus on these things. I'm going to do some tests, order this X-ray, order this and that, and then let's do a telemedicine visit so that you don't necessarily have to take off work. We can do it maybe do your lunch during your lunch hour. We click on to a virtual visit, a Zoom real quick. I review the results, let you know what we saw, and then we go from there. So that was actually very helpful. And that was one thing we learned from the pandemic too, is that we could do effective medicine via telemedicine. Now, whether or not the insurance companies are going to reimburse the same is a big issue right now that the kind of the pandemic is over. But that was another helpful tactic that I would use so that, and I was okay with that being an overbook, right? So in between two routine visits or a routine and a wellness checkup or a physical, I could run into my office real quick while the nurse is, putting in that next patient, pull up the Zoom. We talk for 5 to 10 minutes. They feel like you have a really good amount, even though it's a short visit, they feel like you are fully engaged because you were looking at them on the camera the whole time and you're answering, those one or two questions that you all had already kind of pre-planned for the visit. So using telemedicine and virtual visits if you can, if your the insurances that you have in your office, if they're covered well, can be a good way to do those follow-ups so that the patient feels like you're really, listening to their issues.
That is really good advice because it benefits both you, the healthcare practitioner, and it also benefits your patients. So it takes some of the stress out of the situation. Again, setting those boundaries is so important. And I know that we talk about boundaries a lot in a variety of different ways, but with physicians in particular, setting that boundary sounds like it is a perfect way in which to interact with your patients so that it becomes very productive. So what are some of the other things that you recommend in terms of physicians and how one heals themselves?
Yeah. So I mentioned earlier before with the FMLA, one of my good friends that is a psychiatrist, I scheduled sessions with her. Whether or not you have some medical or mental health disorder or diagnosis, seeking out a therapist, a counselor, whether it's in your church, pastoral counseling, a professional licensed social worker, counselor, or psychiatrist, having those scheduled sessions to talk about what's been going on in your life are it is I can't I mean, worth $1 million. It's wonderful. That's one way. Another way is, and if you're still in the clinical setting or in an office setting of some sort and you're, locked in the four walls, especially if you don't have windows in your office, get outside. If you can run outside for a quick second, whether it's running to go grab some lunch and getting some fresh air, or we were in a setting that had a really nice kind of place that you could take a walk in the trees and in nature. Take some time to go outside, get some fresh air, walk around, get some exercise if you can. Our office also, I use my office a lot as a reference point, but we did a lot in terms of trying to make the environment as joyful and as healthy as we could for our employees. So we even had an exercise room, so we had a yoga mat, we had a little pull-out ottoman if you need to just close your eyes for a moment, take a quick cat nap. We would really make that part of the office setting and part of our culture so that we would encourage one another to take a break. You haven't sat down, since seeing these 20 to 30 patients, please go and close your eyes for a minute. I'll come wake you up. Like you need that to be something that is encouraged in your workplace, because it can't just be, oh, I can't wait till I get home because then I can relax. Hopefully there are some ways you can find little pieces, even if it's 10, 15 minutes, pieces of relaxation even in the workspace. Um, so what else? And then, incorporating exercise. So we've talked about yoga. I've gotten into step aerobics recently. So there's a weekly class that I just commit to. And that's going to be, Mondays are my step aerobics days, and that just becomes a habit. Pilates, that's my weekend deal. So, commit and make that part of it has to be part of your schedule, part of your routine. You have to put it on the calendar, just like you put everyone else's dental appointments and doctor appointments and soccer practice and all that. Everyone else's stuff on the calendar, you got to schedule your stuff on the calendar as well, so that it is a priority.
So they sound really basic, but when
Mhm.
you're a healthcare practitioner, and again, we don't want to encourage healthcare practitioners to quit medicine because there are too few of you. But we,
Although I did quit.
but we have seen that, and that may be the
Yeah.
ultimate decision. You have to also give yourself permission to either quit taking care of other people aside from maybe your partner
Immediate
and your
family.
parents and your babies,
Yeah.
even if your babies are 30. So you have to give yourself permission to quit some of these, the profession, to
Hmm.
find a different path and a purpose. And that was also part of the book. So one of the chapter authors talks about finding a different purpose. One talks about finding a different medical specialty. So let's
Mhm.
face it, not all medical specialties have the same level of demands. Talking about radiology as one, right?
Mm.
And this
Pathology is another
and
one.
pathology is another.
Dermatology, they have great lifestyles.
So so perhaps it's a shift. It's
Mhm.
not necessarily an exodus, but it's a shift from what you're doing now. If you're an ER, or if you're cardiothoracic surgeon, you're an OBGYN. Oh, God bless the OBGYNs, because we know that, they're called in,
Going through a
right?
lot.
I don't think they ever get out of, they change from one set of scrubs to another, right?
Right.
But maybe that's not what you need right now in your life. So giving yourself permission to make some of those adjustments.
Yeah.
So maybe we talk a little bit about those that do decide, though, that this isn't for them. What's left? What's next? You have all this
Yeah.
great training.
Absolutely. So you're right. So, a lot of what I do when I talk to my physician colleagues, when they, schedule a time to sit and have a consultation with me about life and career, a lot of what I do is give them permission. Like I said, as physicians or as type A women, we often need someone that is in our shoes or that we see that's kind of in the same situation that we're in, that understands where we're coming from, speaking the same language to tell us it's okay to stop. We really, and you would be surprised how many women are literally just waiting for someone to tell them it's okay to rest, it's okay to quit, it's okay to do that. So that's a lot of what I do. And sometimes I'll even write on a prescription pad, go take a nap. Take a week off from work. Like we literally need that. So that's one way. But you're right, so for you either, some people want to quit like I did. I quit in clinical practice, meaning practicing within the four walls of a clinical setting, but that doesn't mean that I gave up medicine. I will still and will always be a hopefully board certified as long as I can keep up with my CME and taking my boards and all that stuff. But I will always be a family doctor. I will always have MD behind my name. And that is actually one of the benefits of going into medicine is that it is lifelong. Whether you are practicing actively or not, you will always be a physician, a provider. So you can use that in many different ways. So you mentioned one great way to kind of shift is, and shout out to my primary, I always have to give love to my primary care folks that are, family medicine, internal medicine, pediatrics. We are on the front lines, and it is hard work. We are the jack of all trade, the Jack and the Jane of all trades, and it is hard. So a lot of us end up potentially doing extra training to maybe specialize in obesity medicine. That's a big one nowadays. Another big one is getting double certified and having a psychiatry component to what you're doing. So there are family med doctors that also do a little bit of psychiatry training to get really good with mental health. Although as a family physician, we do mental health all day, but they get extra training to have that double boarded psychiatry certification next to their name. Or as you mentioned, if you're a CT surgeon and you just want to do maybe general surgery, like you want to not have to deal with the high energy emergency urgent cases of dealing with the heart and the lung, but you still love to be in the OR, maybe you can kind of quote downgrade to general surgery for a while. Or what one of my best friends did is she's was trained as an OBGYN, was in private practice, loved it, running, catching babies in the OR, loved it, but took a mission trip to Africa, to Zambia, saw the work that needed to be done there and said, now I want to do specifically global gynecology and oncology. So she went back to school to do an extra fellowship so that now instead of delivering babies here in America, she just does cancer treatment, but primarily in Zambia. So that shifted the way that she's practiced, and she had to go back and get extra training for that, and that took some time. But now she is much happier, feels much more fulfilled than when she was just in private practice delivering babies. So there are many ways that you can shift, move, adjust, take time out, not do surgery and just see patients in the clinic, or just not see patients in clinic at all, which is what I do. I do now what's called utilization management, which has come under some scrutiny recently. But what we are, the company that I work for, is kind of the middleman between the insurance companies and the private and the physician practices where they get referred for studies and they get approved or denied. And we are kind of the middlemen that help to approve the studies if everything is good, or if they're denied, we do peer-to-peer reviews and help the offices figure out what they need to do in order to get it approved. So I'm still using my medical expertise because I have to review the notes, I have to review the cases, I have to talk to the physicians, make sure the notes say what they need to say, make sure they've done all those steps. So I'm still practicing medicine in that way, but I'm doing it from home. I'm doing it in front of my computer and on the phone. So that I have that component as my part-time kind of bread and butter, but then I have extra time for the other stuff that I love to do that are still within the realm of health and wellness. So lots of different ways that you can spin it.
And we talk about physicians as coaches. You can coach each other, which is what we're hearing today. So this is largely directed at healthcare practitioners, but not exclusively, which is why I said largely directed at healthcare practitioners because they don't get enough love. And we know that. There's a lot, we tend to be a little bit too indicting, but you're all healthcare heroes. You don't do this for greed and avarice. You do this because you care about people and you're hyper empaths, and that carries a lot of baggage with it. I know I'm a hyper empath, so I feel your pain. But the bottom line is that this has applicability to all of us, and especially to women, because
Mhm.
this is what we do at FemPharma. We focus exclusively on women. And so for women, this becomes even more important to give ourselves permission to do some of the things that you just shared. As physician life coaches, again, there's an opportunity for us, those of us that aren't healthcare practitioners, to benefit by
Yeah.
what you've learned through this process. So my takeaway after reading this book was that we can all take a page, figuratively speaking, out of this book and apply it to whatever we do. As I said, could be a CEO of a company, could be a factory worker, could be a nurse, could be a healthcare practitioner. Basically, any woman, any walk of life, we can all relate. We
Mhm.
can all relate to what it means to be stressed out, burnt out, overwhelmed, or underwhelmed, as the case may be, and feeling like, is there more to life?
Right.
This. What can I do? How do I make that pivot? So this is really helpful. And as physician coaches, you offer a lot of value to your patients. Tell us
Mhm.
about that.
I think, one thing that I hear a lot and either have heard a lot in clinical practice and then even after leaving clinical practice is how folks are drawn to my transparency and my honesty about what's going on with me.
Absolutely.
So, I would like to encourage us women, particularly female physicians, to open up about your own personal journey. Tell them what's going on with you. Tell them if you're having a bad day. Tell them if you're tired. Tell them if you're sleepy. Tell them, share that. Share that, I'm trying to lose the baby weight too. I have teenagers. I'm still trying to lose the baby weight. Patients like to be able to relate to you in a real human way. Speak to them on their level. Tell them about what's going on with you. Don't try to pretend that everything is great all the time because it's not. And we have our own health and wellness journeys that I think people will be inspired by and encouraged by. So the value, I think, comes from just being true to who you are as a human being. I
I
used
love
to tell
that.
my folks all the time, and I've seen a therapist, before, and I think it's great. Have you seen one before? Let me give you my five, favorites. People really respond well to that. So the value that you have not only has to do with how much you know, how much education you have, the expertise that you have, and all that, but tell them your story so that they can relate to you on a human level, and people will really, really respect that.
And that's another part of that's why I recommend this book to those of you that are listening, whether you're a healthcare practitioner or you are a woman like me. Reading this book was so enlightening because these physicians authentically shared what they went through in their journey, starting with, in some cases, childhood,
Mhm.
and sort of these aspirational goals that they had, not necessarily appreciating the difficulty, and then confronting that after they entered medical school, at following medical school into a fellowship, into private practice. And let's face it, whether you're a physician or not, you've probably experienced something similar, but hearing about this, reading about their authentic selves makes a big difference. I I appreciated this so much from having worked in a hospital, not as a physician, but while I was a college student. And so now when I see my healthcare practitioner, I always say, how are you?
That's
Even if I'm
lovely.
lying on a gurney, and I have been on a gurney in a hospital, not a lot, thank God, but I always say, and how are you doing?
That might bring a lot of them to tears, just how sweet that is, really, honestly.
How are you doing? Because they're there. I know that I'm there maybe waiting for them to care for me, but that's a human being on the other side that probably has experienced much of what I'm experiencing in my life, but it's I need to validate that. And so
Right.
I strongly encourage anybody listening,
Yeah.
have compassion for this person that's there to take care of you. By the way, you might actually find that they do a much better job of taking care of you when you aren't that woman who is
That's
demanding.
yep.
You know,
That's right.
it's not your job, man or woman.
That's right.
You're a human being. Related to a human being.
Mhm. That's good. Good. And then be ready to hear what they have to say.
Exactly. Listen,
It
don't
might
just
be a therapy session after that. Like, I
yeah,
don't know
just
what it is.
just don't move on to the next subject. Actually, like listen, hear what they have to say and respond. You'll be surprised what you get out of that. It benefits both of you.
Yeah, or ask how the kids are doing and, oh, what
Exactly.
grade are they in now? Okay, good.
Exactly.
All right, now let's
Exactly.
talk about my blood pressure. Yeah.
Yeah,
Yeah.
exactly. Exactly. Well, by the way, you know that phenomenon of, your blood pressure rises when you walk in with and you
White
see the
coat.
person with the white coat. If you start the conversation that way, maybe your blood pressure kind of keeps, it's a little bit better controlled because now you're not all whacked out because the healthcare practitioner across the table from you just told you about the teenage daughter that, went to the party, was supposed to be home by midnight, didn't come in, and you're like,
That's
oh,
right.
you're trying to calm her down.
You're like, me too. Okay.
Yeah,
Yeah.
I
Yeah,
get you.
you're right.
I get you. Yes, I get you. Me too. Exactly. Exactly. Well, Dr. Nicole Swiner, this is all great advice. And again, I'm going to read the title again, Doctoring Better. 11 top doctors, physician coaches reveal secrets for helping others to create better lives.
Mhm.
Wherever you get books, if you like paper copies or Kindle, you can purchase this, and it is a worthwhile read. I strongly encourage you, whether you're a healthcare practitioner or a layperson like me, read the book. You won't be disappointed.
I appreciate that. Thanks for having me again.
Of course, of course. Well, thank you so much. And remember to love Mia Vita. Thank you for joining us on the Love Mia Vita podcast. Love Mia Vita means love my life, and that is a mantra we should all live by. Please like and subscribe wherever you get your podcasts, and check out our website at fempharma.com. Remember to live well and love Mia Vita.